Hello, this is Yessica Caramaya. The purpose of this presentation is to analyze and inform about the application 3D Brain and its usefulness to nurses and other healthcare professionals during their daily practice. The purpose of 3D Brain is an educational resource tool to the nurse and other users. The application is an interactive brain map with 29 structures and allows the nurse to rotate the brain in a three-dimensional space. It can benefit and be used by physicians, nurses, educators, and patients. It is available free for download through the Android Play Store and iOS iTunes Store. The utility of 3D Brain for the nurse is specific to nursing education. The application is a visual and interactive resource of the brain in the clinical setting on neurological and mental health patients. It can also be a reference tool for patients and family members on disorders and trauma-related brain injuries. It allows for functional information on over 29 structures of the brain, cognitive disorders, and or damage related to each of those individual structures, provides case studies, and links to full text on the case studies and research. Links provided are all to the National Center of Biotechnology Information, U.S. National Library of Medicine, and the University of Washington's Brain Info website. The layout of this application is simple to use and organize. It is easy to learn and to navigate. There is a Help tab in the application itself that has instructions on how to use the application if needed. The flow of the app is efficient with fast access between screens and links provided, and searches done within the app are also quick. The application can be confusing at times as it uses anatomy and physiological verbiage that not all nurses may be familiar with. When opening the application, there is a top ribbon with three main top headings: 3D View, Labels, and Info of the structure chosen. Under the Info tab, information is as listed: overview of the structure, case studies, associated functions, associated cognitive disorders, associated with damage, substructures, if any, research reviews with links to the full research and additional links that may be useful. However, not all links work within the application. There is also a search bar available which can help the nurse locate keywords within the application. All structures associated with the keyword will be listed and keywords highlighted. 3D Brain has no current legal or ethical issues associated with it. No personal information is requested from the application at any time during its use. No request for personal access is needed from the application to the device it is being downloaded onto, and no information is stored within the application. The purpose of this application is only to inform and educate the nurse. However, the last update was done in 2017. Any information gathered through 3D Brain should involve further research on current research updates. The overall benefits of this application are that it is easy to use, interactive with a 3D visual of the brain, and color coordinated with labels. It is a great educational resource tool for information on the brain and associations with functions, cognitive disorders, and damage. Links and case studies provided are all scholarly resources from government and school websites. There are no advertisements, and it is free for download for Androids and iPhones. Limitations of the application include that the most recent update was in 2017. Because of this, nurses and other users should use this application as only one resource and conduct further research on topics obtained from the application. Lastly, not all links work. Overall, 3D Brain is recommended, as it is a great educational and reference tool for nurses and patients on information of the brain, cautioning that further resources be used in conjunction with this application. In conclusion, the 3D Brain application is a useful educational tool to nurses and patients on the brain and its structures. It is a fast and helpful resource that is interactive and easy to use for any bedside nurse needing further information on structures and associated functions, damage, and or cognitive issues, as well as readily available links and case studies. The greatest issues being that it was last updated in 2017 and not all links are functioning. Overall, it is a useful resource for any nurse on educational information about the brain, especially on associated cognitive disorders and damage. Thank you. For additional information and references, please see the following slide or visit Google Play Store or iTunes to download 3D Brain.